You've stretched it. You've rested it. You've probably seen a doctor, maybe a physio, maybe a chiropractor. You've been told it's your disc, your posture, or, the one that stings the most, your age. And it keeps coming back. Here is what nobody in any of those appointments told you. The thing you have been treating almost certainly isn't the thing causing your pain. Not slightly off, fundamentally, mechanistically wrong. And the 3 decades of peer-reviewed research proving that is exactly why every fix you've tried has worked temporarily and then stopped working. By the end of this video, you're going to understand something about your own spine that most people with chronic lower back pain, and genuinely, many of the clinicians treating it, do not. And you're going to leave doing something completely different from what you came in planning to do. Stay with me. Let's start with what you've probably been told. Your back hurts because of your disc, or because of your posture, or, and this one is the most damaging, because of your age. You're just getting older, and this is what that feels like. These 3 explanations are what most people walk out of a doctor's office with. And to be fair, they're not entirely wrong, but they are dangerously incomplete. And the gap between what they explain and what's actually happening in your body is precisely why most back pain treatment fails. Here's the problem with the disc explanation. In 1994, researchers at the University of Washington published a now famous study in the New England Journal of Medicine. They took a group of 98 adults who had no back pain whatsoever, 0 symptoms, and scanned their spines with MRI. What they found was extraordinary. 64% of those pain-free adults had abnormal discs. 38% had herniated discs. 20% showed evidence of spinal stenosis in people who felt completely fine. Later research expanded on this considerably. A 2015 systematic review published in the American Journal of Neuroradiology analyzed MRI findings across thousands of asymptomatic adults and found that disc degeneration, the structural finding most commonly cited as the cause of back pain, was present in 37% of 20-year-olds and over 96% of 80-year-olds, all without pain, all without symptoms. Read that again. The structural changes are nearly universal in aging spines. The pain is not, which means the disc isn't the whole story. Something else is determining who hurts and who doesn't. And that something else is what almost nobody ever explains to you. Stay with me. This is the part that changes everything. Your lower back is stabilized by a muscle called the multifidus. It runs along either side of your spine, connecting vertebra to vertebra throughout your entire lumbar region. It's not a large muscle. You've probably never thought about it once in your life. But it is arguably the most important muscle in your posterior chain for spinal stability because it fires before you move. Before your arms lift, before your legs step, before any voluntary movement happens at all, your nervous system is supposed to pre-activate the multifidus to brace your spine against the load that's coming. In people with healthy backs, this happens automatically, unconsciously. The spine is protected before it's even asked to do anything. But here's what happens the moment you experience a significant episode of lower back pain. Researchers at the University of Queensland, Paul Hodges and Carolyn Richardson, 2 of the most cited scientists in spinal rehabilitation, discovered in the late 1990s that back pain fundamentally disrupts this system. Their electromyography studies showed that in people with a history of back pain, the multifidus stops firing on time. The automatic pre-activation disappears. The muscle becomes inhibited, not weak in the traditional sense, but neurologically switched off. Your nervous system, having experienced pain in that region, removes the multifidus from its automatic movement preparation sequence as a protective response. And here is the part that turns this into a trap. The pain eventually goes away. The inhibition stays. You feel better. You return to your normal life. But your spine is no longer being pre-stabilized before movement. So every time you load it, every time you stand up, bend forward, twist, lift something from a low shelf, the vertebrae are absorbing forces they were never designed to handle unsupported. Surrounding muscles overwork to compensate. Joints compress under repeated unguarded loading. And eventually, the pain returns. This is the cycle most people are living inside. Not because their disc is ruined, not because they're too old. Because a critical stabilizing system was switched off by their own nervous system often years ago, and nobody ever switched it back on. Let me tell you about someone I'll call David. 53 years old, desk job, occasional weekend hiking. He had experienced lower back pain on and off since his late 30s. Every flare-up, he would stretch his hamstrings, rest for a few days, and eventually feel better. His doctor had identified a minor disc bulge at L4 to L5. Common, nothing surgical. He'd learned to manage it and moved on. What David didn't know, what nobody told him, was that every time he rested and recovered, his multifidus stayed offline. His body was quietly learning to move without its primary spinal stabilizer. His back pain wasn't fundamentally a disc problem. It was a motor control problem. And the stretching he'd been doing faithfully for 15 years was doing absolutely nothing to address it. So what does actually addressing it look like? The research points clearly to one category of intervention: motor control exercises, not general core strengthening, not planks, not stretching. Specific, low-load movements designed to reteach the nervous system to activate the multifidus and its partner stabilizer, the deep transverse abdominis, before and during movement. A landmark clinical trial published in the journal Spine, led by Julie Hides at the University of Queensland, followed two groups of patients recovering from their first acute lower back pain episode. One group received standard medical care, rest, pain management, and general advice. The other received specific motor control training targeting multifidus reactivation. At 1 year follow-up, the recurrence rate in the standard care group was 84%. In the motor control group, it was 30%. Same initial injury, dramatically different outcomes. Because one group reactivated the stabilizing system, the other didn't. Here is what the reactivation actually looks like in practice. And I want you to notice immediately how different this feels from anything you've been told to do before. Lie down on your back, knees bent, feet on the floor. Normal resting position. Nothing dramatic yet. Now find your hip bones, those two bony points at the front of your pelvis. Move your fingertips about 2 centimeters inward and downward from each one. You're now sitting directly over the transverse abdominis, the deep layer of your stabilizing system that goes offline before the multifidus does. Here's what you're not going to do. You're not going to suck your stomach in hard. You're not going to brace like someone is about to punch you. Both of those are the wrong muscles. Both of those are what people do in every generic core exercise video you've ever seen, and both of those have nothing to do with what we're trying to reactivate. What you are going to do is this. Take a slow breath in, and as you breathe out, gently, as if you're trying not to spill something, draw your lower abdomen inward. Not your whole stomach, not a crunch, just the space below your navel, moving slightly back toward your spine. A small, quiet contraction that most people have genuinely never consciously felt before. If you feel it, that subtle, deep tension under your fingertips, that is your stabilizing system waking up. That is the signal your nervous system stops sending automatically after your first serious back pain episode. You are manually reintroducing it. Hold that for 10 seconds. Keep breathing normally. Release fully. Do that 10 times. Now the second movement, and this is where it gets interesting. Maintain that same gentle contraction, and while holding it, slowly slide one heel along the floor until that leg is completely straight, then slowly bring it back. Your back should not move. Your pelvis should not tilt. One side, then the other. 5 repetitions each. What you're training here is the gap, the space between your spine and your moving limbs. You're teaching your nervous system that your spine can remain braced and protected while your body does something else, which is exactly what it forgot how to do. This is not a workout. This takes 4 minutes. You do it once a day. The goal isn't muscle fatigue. The goal is neurological repetition, giving your nervous system enough correct practice that it starts doing this automatically again, the way it did before pain disrupted the pattern. Here's the mistake almost everyone makes, and it's the reason most people stay inside the cycle indefinitely. When their back hurts, they stretch it. Hip flexors, hamstrings, piriformis. The pain often settles temporarily, which reinforces the behavior. But stretching addresses length and tension. It does nothing to reactivate an inhibited multifidus, nothing. It's the mechanical equivalent of lubricating a door hinge when the door frame itself is broken. Things feel smoother momentarily, but the structural problem is completely untouched. Some stretches actively make matters worse. Aggressive lumbar flexion stretches in people with posterior disc involvement increase pressure directly on the tissue you're trying to calm. The research on this is consistent across decades. And yet, stretching remains the default self-treatment recommendation for lower back pain in virtually every mainstream health context you'll encounter. The reason is straightforward. The real explanation is harder to communicate than stretch this muscle for 30 seconds. But you just sat through the real explanation, which means you now understand something that most people with chronic lower back pain, and genuinely many practitioners treating it, do not. You came into this video probably thinking your back hurt because of your disc, your posture, or your age. You now know the real answer is a stabilizing system that went offline, possibly years ago, possibly after an injury you barely remember, and was never reactivated. It's a motor control problem wearing the disguise of a structural one. And motor control problems have motor control solutions. You are not too old for this to change. Hodges' own research documented successful multifidus reactivation in adults well into their 60s and 70s with consistent targeted training. The nervous system retains the capacity to relearn these patterns at every age. It just needs to be given the right input. Your back was not built to hurt by default. It was built with a protection system. You just need to turn it back on. If this gave you something your last doctor's appointment didn't, subscribe. Every week on this channel, we break down the real biology behind how your body ages, why it moves the way it moves, and exactly what the science says to do about it in minutes a day, not hours. The mechanism is always simpler than the marketing around it. You just have to know where to look.